enforcement still remains nebulous.
We're breaking in right now to bring you Governor Mike DeWine's latest coronavirus news conference.
Here it is.
Columbus and
The news about the coronavirus.
Youth Services Director.
That's right.
Maxfield, Ohio Department
The
of
news
Commerce
about the
Director,
coronavirus.
Dan Tierney, our press secretary. Happy birthday to all of you. Last week we talked about the minimum requirements and steps that K through 12 schools will need to take to reopen. Today we want to talk about our colleges and universities. 167 institutions of higher learning in the state of Ohio. We are very, very proud of these schools, public and private. Ohio is blessed to have them. They also, of course, are preparing to start up school again, and for most of them, returning to campus. Colleges and universities really drive our economy. They drive the local economy of that village, city, but they also drive our economy in many other ways. They train our future workforce, your major employers. They conduct the research in health and technology that makes Ohio a national leader. That's why we're going to do what we can to support them in this endeavor. The Ohio Department of Higher Education, in consultation with our colleges, universities, Ohio Department of Health, and health experts across the state, produce guidance for our campuses to reopen for students, faculty, and staff in the safest way possible. I want to give a shout out to Randy Gardner, the Chancellor, who has worked tirelessly on this along with his team, and had a lot of conversations with our colleges over the last several months.
The news about the coronavirus.
We are releasing guidance today.
That's right.
It is at www.coronavirus.ohio.gov. Coronavirus.ohio.gov. This includes minimum operating standards that should occur on all campuses in the state, as well as best practices to further enhance those standards. By implementing these minimum requirements and implementing best practices, our higher education communities continue to educate students and prevent the spread of COVID-19. Ohio's 2-year and 4-year colleges and universities are unique.
The news about the coronavirus.
Students, faculty, staff.
That's right.
As they plan for their operations.
The news about the coronavirus.
Testing will be an integral part of their comprehensive strategies to stop the spread of COVID-19. Each of Ohio's campuses must identify how it can best implement COVID-19 testing within the institution. Each campus must develop policies and procedures tailored to their particular campus, their particular community, all related to COVID-19 testing and the isolation of those students who are showing symptoms, those faculty and staff members as well. Testing of these individuals showing symptoms should certainly take priority over all other testing tactics. Testing, we would hope, would be complete within a short period of time after it's done, so that they can take the appropriate action. It is recommended that each campus either designate a university housing space to be set aside or secure local living space to be left empty, so that it may be useful to rapidly relocate individuals who live in residence halls, fraternities, sorority houses, or other institutional affiliated housing, those individuals who become symptomatic. Now we know that this costs money. We know that COVID-19 prevention efforts, safety precautions, educating students this school year in a safe and healthy environment will be certainly more expensive than it has been in the years past. And that is a significant burden. So to help address these increasing costs, I've spoken and worked with Speaker Householder, Senate President Larry Obhoff, as well as Democrat leaders Yuko and Sykes. All 5 of us have looked at this. All 5 of us have had our teams working on this, and we believe we have come up with something that will be very helpful to both our K through 12 schools, our K through 12 schools, as well as our colleges and universities, both public and private. To start that, we're requesting that the controlling board that's scheduled to meet, I believe, on Monday, approve our initial request on Monday to allocate $200 million for higher education and $100 million for K through 12 from the Coronavirus Relief Fund to help meet these increasing costs. As I said, we hope to have additional money, and the figure that we have been talking about for example, K through 12 is certainly higher than that initial $100 million. But we wanted to get this $100 million out, and we wanted to let the schools be able to plan based upon that money coming. As I said, this money comes from Federal CARES Act dollars. I want to thank our members of the of the federal Congress, both in the House and the Senate, for providing these CARE dollars. Funding comes from Federal CARES Act dollars. And schools will be able to use it to meet their unique individual needs. We intend for this funding to be flexible. For example, and these are just examples, a community college may need assistance funding testing at their student health center. A school district, a local school district, may need a nurse to help with symptoms assessment. A university could use funding to purchase PPE. These are just all examples of many things, many ways that this money could be spent. Some may even choose to use this funding to provide connectivity to students and grow distance learning options. The bottom line is that we intend these funds to be used to serve students to prevent the spread of COVID-19. And again, we want our kids back in school. We want them safe. And this money will help achieve that. At the K through 12 level, we intend to make the funding available to all public and private schools. For Ohio's higher educational institutions, we plan to make this available to 2- and 4-year colleges and universities, both public and private, including adult career tech providers. To put it simply, if you educate students in Ohio, we want to provide additional support with some of the federal funding that we have available. Our request is from in regard to the controlling board, that we are asking the controlling board. There is additional money, though, that I would point out that is being made available through the CARES Act for education in the state of Ohio. $440 million in direct CARES Act funding is available for our K through 12 schools. $440 million. This is money that when they incur a cost, that they can draw this money down. The state's colleges and universities also receive more than $190 million of direct federal funding. So the two figures I've given you, $440 million for K through 12, $190 million for higher education in the state of Ohio. That is in addition to the money that we're asking the state controlling board to approve on Monday. We hope that schools take advantage of this funding. We certainly realize, however, that it may not cover all of the increased expenses schools face during this pandemic. We're going to continue to look to see if we can provide additional funds in the future, but we wanted to get started with these dollars. I want to talk about homelessness grant. In April, I announced a $1 million grant to the Coalition of Homelessness and Housing to support homelessness prevention efforts and to rapidly rehouse individuals and families who were, in fact, experiencing homelessness. Those experiencing homelessness certainly can be at great risk of contracting COVID, especially those in congregate facilities such as homeless shelters. Therefore, it is important to do everything we can to keep them out of those situations. With these resources, We're going to be able to keep hundreds of Ohioans safely housed during this pandemic. Today I'm announcing an additional $15 million grant to ensure Ohioans can maintain their housing during this time. COVID-19 is still very, very much with us. I don't have to remind anybody of that. And these resources will help thousands of families across our state stay housed, stay healthy, and get ready for the future. We are all now, as the virus spreads, we're all starting to experience knowing people who have come down with COVID-19. We received word today that someone on my staff has tested positive for COVID-19. The individual has been working from home since the start of this pandemic. We wish the person best as they recover. And this, I guess, is just a reminder for everyone that this virus is very, very, very much with us. Let's go and look at the data for today. First, we'll start with the key indicators. And again, starting with the cases, we're seeing cases hover above 1,000 a day.
Here it
which
is.
Significantly higher.
The news
than
about the
certainly
coronavirus.
Before.
That's right.
We're reporting
The
today
news about the
1,150
coronavirus.
new cases that we've learned about from local health departments during the last 24 hours. This is a little bit lower than our peak last week, but still considerably higher than where we were 3 weeks ago. This is consistent with the pattern we've seen and are continuing to see, where the number of new cases is much higher than it was. Looking at the rest of the data, you'll see here the deaths the last 24 hours were 15 of our fellow citizens. The 21-day average is 18, so that's a little bit under that. The hospitalization is up above the 21-day average. That's 81 versus a average of 70 for 21 days. And the ICU admissions is up a little bit statewide as well. And when we get to the further data, we'll kind of look at this as it breaks out by region of the state. Let's look, Eric, at the next one. And let me just also point out that these are some of these are in fact lagging indicators, certainly in regard to hospitalization. And when we get to new cases, that is even further out before we see people go to the hospital or we see them get into ICU. Let's look at this is the current confirmed COVID-19 patient count in Ohio hospitals by day. The previous slide depicted the number of new COVID-19 hospitalizations that we have reported. This slide also looks at hospitalizations, but it shows the daily number of COVID-19 patients that are currently in Ohio hospitals. You can see from this slide that on June 26th, for example, there were 619 COVID-19 patients in hospitals around the state of Ohio. Since then, we've increased that. And as of today, a snapshot as of today, 905. So June 26, 619, today 905 COVID patients in our hospitals in the state of Ohio. During the past few weeks, this increase has been steady, which is certainly concerning, and as we see these numbers go up. Let's turn to the next slide, which is the testing and positivity slide. We continue to increase our testing capacity in Ohio during the last few weeks. We know that testing is an important component of the ongoing monitoring of this virus. We do see a kind of a different effect, and I asked our team about this today. This is a number we look at. We have positivity numbers statewide. So in other words, of the tests that were done, what percentage were positive? Snapshot, the last day we have available, 6.4. That has hovered between 4 and 6 for some time. This is a higher number. We don't particularly like that number, but we are seeing, for whatever reason in reporting, that on the weekends, the positivity number is just less. And that may be who's getting, obviously it's who's getting tested, where they're getting tested. So we're not really sure. So the most important thing is really to look at this in a 7-day average. And we'll try in the future.
Here it is.
Show you this for the day.
The news about the
But I think 7-day
coronavirus.
average gives us probably a much better
That's right.
look at what is
The
what
news
is going
about the
on.
coronavirus.
But the positivity rate reported for July 7th, which is was 6.4%, which is Ohio's highest since May 25th. Since May 25th. Now we're going to look at the new level map. And you will obviously see some changes, and I'm going to go through that. We're going to do this once a week. We're doing it basically on Wednesday. Once the Wednesday data comes out, then our team starts working with that data. Our data team has been working, analyzing the data over the past week, updated the status of our counties on the public health alert system. I want to remind everyone that there are a number of different data points that we look at. 3 of the data points have to do with cases. The team looks at new cases per capita. They determine if there is a sustained increase in new cases. They look at the proportion of cases that are not in a congregate setting. Another group of indicators looks at symptoms. They look for a sustained increase in emergency department visits, sustained increase in outpatient visits, such as people going to see their doctor's office with suspected or confirmed cases. The team also looks for sustained increases in new COVID-19 hospitalizations and increase in intensive care unit bed occupancy. Additional indicators will ultimately be factors, but are not yet, will include contact tracing, test per capita, and percent positivity. We do not have, for example, the test positivity broken down yet. We don't have the ability to do that by county, but we are certainly looking at that. And again, to review, counties that meet 0 to 1 indicators are Public Health Advisory Level 1, yellow. Level 2, orange, is triggered when 2 to 3 public health indicators are met. For counties that meet 4 to 5 indicators, they're listed as Level 3, which is the red counties. Once a county is at Level 3, the additional factor that then comes into play is that they cannot improve their risk level category unless cases drop below the Centers for Disease Control and Prevention's threshold for high incidence. And that is 100 new cases per 100,000 people over the last 2 weeks. For a county to be considered Level 4 or purple, a county must trigger 6 or more indicators during 2 reporting periods in a row. Once a county is at a Level 4, it cannot improve its risk level until it's not triggered 6 or more indicators for 2 consecutive reporting periods. So let's look at the map, and we'll kind of go through these counties one by one. Let's start with Hamilton County. Hamilton County, you will see, has moved up. It was red. It is now on what we call the watch list, which means it basically has met the criteria to go purple, but we're going to allow a week to elapse and look at the data again another week before we actually move it into that purple, before it looks purple on the map. Hamilton County. During the last 3 weeks, Hamilton County's COVID-19 cases increased along with several other healthcare indicators. Between June 24th and June 30th, Hamilton County had 1,124 cases reported, the largest number of COVID-19 weekly cases reported there since the beginning of the pandemic. From June 16th to June 30th, the average new cases per day doubled. Excuse me, from 82 to 161. 82 to 161. Excuse me. One of the things that the data team reminds me is that on a lot of this data, once you hit July 1, the data is incomplete. So you may see us referring, for example, to another period, June 16th, as I just did, to the 30th, where we said the new cases per day doubled from 82 to 161. We're citing that because July 1 onward, that's still fluid. Those cases are still coming in. As my team reminds me, due to clinical and reporting lags, these numbers may continue to grow for this reporting period. The community continues to experience early signs that more people are seeking medical care for COVID-19 in Hamilton County. For example, from June 16th, if you look at June 16th and June 30th, visits for COVID-19 in the emergency department doubled from an average of 11 per day to 22 per day. More people are also visiting their doctors and being diagnosed with COVID-19 between June 16th and July 2. Average outpatient visits more than tripled, from 52 to 172 visits per day. In recent weeks, over 86% of the cases are not in congregate settings, again, signaling significant transmission in the broader community. Hamilton County also hit a new threshold for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days. And so that last indicator is an indicator for that is used by the region as well. So you'll see that indicator used for Claremont County as well as Butler County. That's the only indicator that is regional because that's how people use ICU units. Someone, for example, in Butler County may, if they're ICU, they may certainly be in Hamilton County. So that metric moving up had an impact on those 3 counties that you see in the farthest southwestern part of the state of Ohio. Let me move to Butler County. During the last 3 weeks, Butler County's COVID-19 cases increased, along with several other healthcare indicators. Between June 24th and June 30th, Butler County had 181 cases reported, the largest number of COVID-19 weekly cases reported for them since the beginning of the pandemic. From June 16th until July 3rd, the average new cases per day doubled from 15 to 29. Due to clinical and reporting lags, these numbers certainly may continue to grow for this reporting period. The community continues to experience early signs that more people are seeking medical care for COVID-19 symptoms. From June 16th, July 4th, visits for COVID-19 symptoms, the emergency department tripled from an average of 2 today to an average of 7 today per day. 2 per day to 7 per day. More people are also visiting their doctors and being diagnosed with COVID-19 between June 16th and between June 16th and July 7th. The average outpatient visits more than doubled from 15 to 38 visits per day. Again, these are the early indicators. And again, as every county in that region did, Butler also hit a new threshold for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days. Again, that is an indicator that is a regional problem because that's where individuals go regionally for intensive care unit beds. Let's jump up to Cuyahoga County. During the last 3 weeks, Cuyahoga County's COVID-19 cases increased along with several other healthcare indicators. Between June 24 and June 30th, Cuyahoga County had 999 cases reported, the largest number of COVID weekly cases reported since the beginning of the pandemic. From June 16th until June 28th, the average new cases per day more than doubled from 66 to 151. Most of the cases in Cuyahoga County were in non-congregate settings during the last 3 weeks. Cuyahoga County residents are seeking care for COVID-19 related concerns at higher levels than ever before. For example, from June 16th, July 1, compare that, visits for COVID-19 to the emergency department more than doubled from an average of 19 per day to 50 per day. Over the same period, the average number of outpatient visits with suspected or confirmed COVID-19 diagnosis increased from 41 to 233. 41 to 233, and that was the average number of outpatient visits with suspected or confirmed COVID. Finally, more residents of Cuyahoga County were admitted to the hospitals for COVID-19. The average hospital admission per day more than doubled from 7 on June 6th to 20 on July 2nd. Let me go back to Clermont County, and again in our same region of the state. During the last 3 weeks, Clermont County's COVID-19 cases increased along with several other healthcare indicators. From June 16th until June 30th, the average new cases per day doubled from 4 to 9. Due to clinical and reporting lags, these numbers may obviously continue to grow for this period. The community continues to experience early signs that more people are seeking medical care for COVID-19 symptoms. More people are visiting their doctors and being diagnosed with COVID-19. Between June 16th and July 2nd, the average outpatient visits nearly tripled from 9 today to 25 visits per day. In recent weeks, over 94% of the cases are not in congregate settings, signaling significant transmission in the broader community spread. Clermont County also hit a new threshold, of course, as I said, for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days. We'll move to Fairfield County. During the last 3 weeks, Fairfield County's COVID-19 cases have increased along with several other healthcare indicators. Fairfield County reported a total of 85 cases per 100,000 residents during the last 14 days, exceeding any previous 2-week period. Over 20% of Fairfield County's total cases have been in the last 2 weeks. So a marked change in Fairfield. Due to clinical and reporting lags, these numbers, of course, may continue to grow for this period. More people are visiting their doctors, being diagnosed with COVID-19. Between June 16th and July 2nd, the average outpatient visits increased from 11 to 16 per day. In recent weeks, over 88% of the cases are not in congregate settings, signaling significant transmission in the broader community. Let's turn to Franklin County. And you will note in Franklin County, we'll get to this in a minute, but we had them on the watch list. We have our data team has now removed them from the watch list. So that's a good thing. This week, Franklin County was removed from the watch list due to a decrease in the number of residents being admitted to the hospital based on a COVID-19 diagnosis. But it still remains as level 3 alert red. Franklin County has reported nearly 2,200 cases during the last 14 days, which means the county exceeds the high incidence category for COVID-19 as defined by the Centers for Disease Control and Prevention. COVID-19 cases have increased along with